to me is the most innovation, the biggest innovation in the medical industry is, as you mentioned, personalization. To me, the idea of people buying a generic food or generic healthcare or generic anything is going to go away. So in my humble opinion, in the next 10 to 20 years, there's no longer people are going to have a Kellogg K sitting there and you pick up the box and come. It's any company that's not personalizing is going to die a slow death or a fast death. Choice is there, but they're going to die. So everything is going to be about me, whether it is the food being 3D printed for me. My water is personalized with my supplement, with my prebiotic, with my probiotic. My yogurt is personalized for me. Every single thing that I buy is going to be personalized for me. My clothes are going to be tailor-made for me, whether they're 3D printed or not, right? I'll be able to get my clothes 3D printed exactly to the thing that I need. And, it's not going to be something, oh my God, you get a tailor-made suit. Everybody's going to have a tailor-made suit, right?
Everyone's going to look really good.
I think that is the key is going to be the personalization.
Right.
And to do personalization, you will need data. So I really think the biggest innovation in the healthcare is going to come not from the healthcare industry, but it's going to come from the outsider who are bringing the ideas and the things. So when people talk about thinking outside the box, it is not that. It is thinking inside a different box. So, people like us are saying, wait a sec, this is not a healthcare. This is a big data problem, right? Can I understand every biochemical activity that's happening in our body? So if I know everything, every biochemistry of our body, and then I can apply AI, I think it's just simply a math and a chemistry. What is the hard problem here, right?
Yeah.
People say it is very complex. Yes, but complex of what? It's chemistry. If we know how our gut microbes transform any compound into any compound, where the compound happens to be a food or it can be a drug, it gets metabolized by our microbiome and it converts into a molecule based on its own. So basically, think of our gut microbiome as a series of chemical reactions.
Right.
And that's very predictable. So in a sense that, now, why is it that certain drugs have different side effects on different people? Is because those drugs get metabolized by different people in their gut very differently. In fact, here's a very interesting one, that there's a drug called levodopa for Parkinson's. And in some people, the drug called L-dopa gets metabolized by gut microbiome into compound that actually has no effect on the Parkinson's. That means the microbes are eating the drug. Think about that for a second. Microbes eat the drug and you can have all the drug in the world. It's not going to help anything. Now imagine if we can give them a right IV, if we can give them a right supplement and nutrients before they eat the levodopa, because the tyrosine is a compound that's produced by the gut microbiome that actually metabolizes the levodopa drug. What if we can absorb the tyrosine by some other nutrient, so you can take levodopa and now you can have actually drug work? So literally not just even making the current drugs more effective, you can still personalize and make them individualized for each person. Same type of thing. What people don't realize is, there is a massive amount of people who are taking these anti-acidity drugs like PPI drugs. And, $6 billion a year market. And I believe if you look at the use of PPI drugs and use of other chronic diseases, especially colorectal cancer and IBD and IBS, you're starting to wonder, is there a connection here? And we were just analyzing the data, in fact, 2 weeks ago, and we saw some very interesting stuff. The oral microbiome, there is a particular organism that is vastly present in almost every oral microbiome. But in the presence of that, when that microbiome doesn't get killed by the stomach acid because you're taking PPI drug and it starts to go into the gut, that microbe is now starting to cause the, IBS, which is stomach pain, all the things from IBS symptom. Or as that bacteria becomes more and more active, it causes IBD. And then eventually when it becomes really virulent, it causes the colorectal cancer. Now imagine, now you can have the vaccines for just that.